What I would say to organizations that are fully insured is you are not in control of your coverage. Being self-insured gives you so much more visibility to the information on what's happening with your employees, what's happening with your expenses, and it gives you visibility to potential places where you can make cost changes or plan changes that really impact and improve health coverage for your employees, but also improve your bottom line costs.
I would tell them to really strongly consider self-insured. We've been self-insured for over 25 years, and there have been many years where people were seeing double-digit increases in the traditional market, and we had nothing. In fact, some years it actually went down because our claims were lower. So what I would say is, some years you win, most years you win. There may be 2 of 5 that you don't, but you don't have that year-over-year increase that you have in the traditional market.
In a fully insured situation, the insurance company is always going to win. When you have a good year, if you only have a 30 or 40% loss year, you've paid in premiums that you're never going to get back. When you have a bad year, if you have a 130 or 140% loss year, you can expect a 30 or 40% increase the next year for them to recover their cost. The difference for those of us who are self-funded is in those good years, we haven't paid those claims out. So if you have a 30 or 40% loss year, you haven't paid all of those losses out. Self-insured, we've been self-insured now for about 5 years. The benefits have been huge for us. We've used some of those savings to fund on-site, near-site clinics for our employees. So for us, it's been a big benefit, but definitely in a fully insured situation, the insurance company's never going to lose.
We were fully insured 4 years ago, and when I learned of self-insurance and how those two processes differ, I mean, fully insured is having a firm fixed number every month, and obviously sometimes that can be comforting, but what we learned is, as we started evaluating the self-insurance program, we learned that we were overpaying it to the tune of, a 7-figure number, over $1 million that we could have saved had we been self-insured. And they never will give you that refund back when you're paying that premium every month if you don't spend it all. But they will bill you if you go over. So you're betting every year in a fully insured program, and self-insured gives you access also to more data. You get claims data information so that you can actually start evaluating why you're spending the dollars and how to fix it then. You can put game plans in place, and we've been able to really start attacking some of our high cost items as we evaluate that data. When you're fully insured, you don't get any of that detailed data. It's one lump number that you get at the end of the month. So, it has been a great move for us, and then obviously going into a captive on top of that is the icing on the cake.